Traumatic hip injury from fall, direct impact, or road traffic accidents. Repetitive microtrauma from sports involving twisting/pivoting. Femoroacetabular impingement, FAI, causing labral stress. Sudden hip rotation or hyperflexion injury. Degenerative changes with age or chronic overuse. Auxein 2.8 mm knotless peak CF push-in suture anchor for efficient arthroscopic labral repair. Peak CF offers bone-like elasticity, radiolucency, and MRI safety. Knotless design eliminates knot tying and reduces soft tissue irritation. Supports secure fixation and anatomical tissue reduction with a streamlined surgical workflow. Position patient supine on traction table with padded perineal post. Establish arthroscopic portals and assess acetabular labrum. Prepare an acetabular rim to create a stable bleeding bone bed while preserving healthy tissue. Use a tissue elevator to mobilize the labrum and prepare it for repair. Insert a reusable suture passer into the hip joint space. Position the reusable suture passer beneath the torn labrum. Pass the nitinol wire through the reusable suture passer. Use a suture retriever through another portal to pull the nitinol wire out. Load the suture onto the wire, then retrieve the wire and reusable suture passer. Retrieve the second end of the suture so both ends exit through one portal, forming a loop around the labrum. Insert the long 8-point drill guide into the hip joint and position it on the acetabular rim at the desired anchor placement site. Use a long 2.5 mm knotless drill bit through the guide and advance until the stopper reaches the drill guide to create the pilot hole. Remove the drill bit and drill guide. Load both sutures into the 2.8 mm knotless peak CF push-in suture anchor with hip length driver. Insert the loaded 2.8 mm knotless peak CF push-in suture anchor in the hole and tap to fix the implant. Tension the suture's limbs to anatomically reduce the labrum against the acetabular rim and restore the labral seal. Remove the driver. Cut off excess sutures. Repeat steps for each anchor to achieve stable labrum fixation. Hip acetabular labrum repair using Auxein's 2.8 mm knotless peak CF push-in suture anchor is completed. Partial weight bearing with crutches for the first 2 to 4 weeks. Controlled range of motion, avoid deep flexion, rotation, and pivoting. Gradual progression to full weight bearing with physiotherapy guidance. Initiate core, abductor, and hip stabilizer strengthening. Avoid high-impact activities until 3 months. Return to sports after 4 to 6 months based on recovery.